The stars are bright, we own the night. The stars are bright, we own. The stars are bright, we own the night. The stars are bright, we own. The
Okay, so good evening, everyone. Welcome to a special presentation of No Better Time Than the Present as we peel back the layers of when women don't feel heard on their health journey. Our host and moderator this evening is Melvina Manuel. We also have guest panel Valarie Traynham from HealthTree. Our other panel guest, Michelle Tedder, will not be joining us this evening as she's held up at the airport traveling back. So she'll be with us in spirit this evening. Okay, so before I hand this over to Melvina, here's a little bit about our host. Mel is a health and wellness goal coach, as well as a social impact entrepreneur. She is the founder of Mel's2021.com, a health and wellness website. Mel received her certification from Cornell University as a New York State citizen public health leader. Additionally, she is an empowered patient advocate under Project Teach, which is a collaboration involving Black Women's Health Imperative, Friends of Cancer, as well as Stand Up to Cancer. Mel is also a writer, a creative producer, and self-producing artist. She is a member of Houses on the Moon Theater Company board and the recipient of the 2023 Michael Alden Promising Producer Award from Theater Resources Unlimited. Mel continues to use her artistic voice and her mission to create impactful community partnerships that will continue to encourage self-advocacy when it comes to social justice issues, such as those involving inequalities within the healthcare system. So my sister, welcome. Thank you for being the host and moderator this evening. And the stage is yours.
Thank you so much, Yolanda. And I'm honored to be here as your moderator and host for tonight's discussion. And this is a very crucial topic that we're going to be covering. So to simply put, as a citizen public health leader, I'm a trusted source of information and health preparedness, not just for my family and friends, but also for my community. And it's these types of conversations that are peer-led, really digging into peer advocacy that are part of that role and kind of lend itself to today's topic. So before we get started, I came across a quote recently from the late Reverend Dr. Martin Luther King Jr. that I thought was very interesting. And the quote goes as follows: "Of all the forms of inequality, injustice in health is the most shocking and inhumane." Now, how alarming is it that this quote came decades ago in the 60s, he said as part of a speech. And in today's society, we're still kind of discussing a lot of those things that are as a result of a lot of systemic issues that we have in our healthcare system. So whether it's race, color, gender, your economic status, your educational background, none of this should determine the quality of healthcare you have or the ability to achieve a healthy outcome. So as part of today's discussion, we'll explore the challenges women face in healthcare, particularly when living with a chronic health condition, and particularly as women of color with a chronic condition. The goal of today's discussion is to raise awareness, encourage advocacy, and work on breaking down some of those barriers that Dr. King referenced in achieving health equity for everyone. So I would like to first start with introducing our esteemed panelists. who will share their insights and experiences with us tonight in several areas of our broader topic on when women feel unheard on their healthcare journey. So, our first panelist is Valarie Traynham. Valarie has been on the myeloma journey since 2015. As a cancer thriver, her goal is to learn about the disease, educate others, and bring light to the health inequity that exists for myeloma patients. She wants to use her voice for those who cannot speak up for themselves to ensure that they receive equitable access to good health care, clinical trials, and proper treatment. She is passionate about teaching others how to be their own best advocate, and Valarie is also a health coach with HealthTree. Welcome, Valarie.
Thank you. Great to
And
be
our
here.
thank you. And our second panelist, well, you know her, Yolanda Brunson-Sarrabo, CPT, BCS. Yolanda is the founder of Spitfir Productions, specializing in brand strategy. She's penned Another Face of Multiple Myeloma, reflecting on her journey with multiple myeloma. Yolanda is currently in remission. She's hopeful for a cure for the disease, but until then, she is living as an advocate for health. Yolanda is also the executive director of May's Breath Foundation, a 501c3 lung cancer awareness organization. She's a 2024 Patient Leader Council member of Health Union, a member of Forbes BLK, and the content creator for this show, No Better Time Than the Present, an IG podcast. Yolanda is also the founder and president of Chronic Fitness LLC, a fitness boutique service for clients with chronic conditions. Welcome, Yolanda. Welcome, Valarie, again to you both. And let's dive right in. So, the first topic I want to cover deals with coping with invisible conditions. So, let's start with discussing how you both navigate healthcare providers, as well as your family or friends who may be around you, who may not necessarily understand your experience. And how does having a condition that is not always visible to others, your loved ones, or your healthcare team impact you? Essentially, how do you cope with an invisible condition? So we could start with you, Valarie.
Yeah, so I think for me, the biggest thing is just taking it one day at a time, um, because that's all you can do is one day at a time. Just focus on what's in front of you. Um, I think the thing that's been most helpful to me when it comes to dealing with an unseen illness is really educating myself about the disease so I can educate others. Because when people see you and you look healthy, you look good, you look normal, they just make that assumption that everything is peachy keen in your life when that's not really the case there. So, what I found, in my situation, particularly when it comes to friends that just don't understand, even though you've had your transplant, you went through the active treatment, there's still things that linger on that they don't get it and they don't understand. So it's it's about educating them about what happens when your treatment stops. It's just because the treatment stopped doesn't mean that, oh, the cancer's gone and everything is back to normal. So educating those people, um, making sure that they can ask questions, giving them that platform to ask questions if it's something that they don't understand, making sure that they get the knowledge that they need about the disease and understand how to best support me. Uh, that's something that, when you have an invisible illness, a lot of times people don't know how to support you because they think everything is okay. So finding your voice and being able to speak up and say, hey, this is what I need, or this is what's going on, are some of the things that's been really helpful, throughout the journey for me.
Excellent, excellent. And Yolanda, would you like to weigh in?
Um, Ditto to whatever everything that Valerie said, because I think for most patients, okay, it is a trial.
Mhm.
Um, but I think it's also maybe psychological in terms of At least for me, you know, I tend to trip out. Okay, am I just exaggerating that I don't feel well? Because, like, a lot of things, like if you have joint pains, certain bone pains going on, and it's like you don't look like anything is going on, but your body is doing what it's doing. So for me, sometimes I'll trip out a little bit, like, is it this? Is it that? But we know within all of this is that myeloma. So despite me being in remission, it's still the after fact, after, situation of the disease. So it can be a trial, okay, as explaining to folk. But then y'all know me, like whatever's whatever with that. But for my own self, I kind of like trip out. Like, it kind of messes with me a little bit in terms of how severe is this pain or this discomfort, and kind of just moving along, if that makes any sense.
Absolutely, absolutely. Can either
Yeah.
of you share a specific instance where you felt unheard by your doctor or your somebody on your healthcare team or even a family member?
Yeah.
Valarie,
So,
let me. Oh, go ahead, Valarie.
well, I want to go back and just comment on what you just said, Yolanda. I think with everything that we're going through, we learn how to develop our own coping strategies when it comes to dealing with everything. You're in a good remission and everything is good, but you still have those feelings, as you explained with the pain there. I think one way of us dealing with it is just developing our own coping strategies to, learn to balance everything out in those times. But yeah, to the next question, I can remember the very first time when I felt unheard by my doctor. I had been on treatment for about a month, and one of the oral chemos, one of the side effects was a rash. Now, I was not aware of that. I woke up, it was a Sunday morning, and I was just itching. And it was an itch that you could scratch it all day long, but it just it wasn't going anywhere. And I had reached out because it's a weekend. I reached out to the doctor that was on call, and they eventually got my doctor. And I was panicked because I didn't know what was going on. All I knew that this rash was just bugging me. And very nonchalantly, he was like, "Oh, this happens all the time. Just calm down, Miss Traynham." And I felt
Wow.
so I felt so taken back. I was like, "Well, it may happen all the time, but you guys didn't tell me about this." Some of the other side effects you mentioned, that, hey, this is probably when you'll start feeling those. But this one, they didn't mention. And in that moment, I had to just stop and take a breath and really just say, okay, I understand this may happen all the time, but it doesn't happen to me all the time. So you're going to have to bear with me on this bright and early Sunday morning with what I'm dealing with here. So that was one of the first times that I really felt unheard and dismissed. And it was very hurtful. It was very traumatic.
Wow, wow. And I think it's sad that you mentioned, coming up with your own coping, way to cope, but it's sad that you have to come up with a way to cope and that we don't, you don't have access to, and I'm not saying everyone, but whoever is, tasked with providing treatment or care. I always thought that that's one of the things that you learn in medical school, maybe silly me, but like just being compassionate, like you said, no matter how routine something may be or how silly it may be, I thought that that's something that's covered, when you're dealing with patients, to just be sensitive to things like that. And you hear stories like this far too often that it's not. So that's quite, disturbing that, I'm happy that there's ways to cope, but I wish that the system was just built a different way so that, it's important for someone to give care, but it's also important for someone to know how to administer that care in a safe, sensitive, humane way,
Yeah.
you know. So Yolanda, did you want to say something else also?
I sure do. So I can relate to everything that Valerie has mentioned. I think the flip side, for me, for a person that is in remission, like my experience. So I've kind of been experiencing stuff post treatment, okay, that has been quite interesting because now, like presently, I'm in a space where I'm not on medication because allegedly I'm in remission, right? However, since I get you're in remission, so people tend to, in terms of the doctors, certain doctors, they tend to forget that my situation is different from the other patient. So though I'm not on certain medications, anymore, things still be happening. Okay. So the experience that I had, um, I won't say it was hurtful. I was about to strictly go Brooklyn on this person. Let's just put it that way. And it's funny because the doctor is also from Brooklyn. So that's kind of what was unique about it. But I recall telling him, um, kind of going back and forth where I wasn't feeling well or something was going on. I forget what the situation was. And he kind of just looked, he had his little laptop open, and then he yawned.
Wow.
Like a big yawn, like I was keeping this mofo up. Okay, I'm gonna be quite transparent at my language, so it's gonna be what it's gonna be. So, like, I was keeping him up, and then he says, "Oh, I wish I was home with my dog." Now, that right there, I was like, I had to like get a grip because my whole time in the myeloma thing, I've had some doctors, it can be a little tricky, but never has anyone been disrespectful like that. To me, I felt that was disrespectful. Hence, which I've kind of on my posts kind of made mention, that's one of the reasons why it's time to find another PCP. Okay. And a PCP is quite needed and important. And if we're not on the same page, or if I'm keeping you up and all of that, then it's time for you to go. So,
Yeah, I think so.
yeah.
Wow.
Mm-hmm.
Okay.
I want to ask,
Exactly.
so curious, Yolanda, what did you do in that moment? I mean, you're sitting there across from this doctor and he's yawning, talking about he'd rather be with his dog. What do you do as a patient? How do you handle that?
Let me tell you, it threw me for a loop a little bit. So I think my mouth was wide open for a little bit. Like, I can't believe
Wow.
you just said that. And right in that moment, I already knew. Like, I was kind of whatever with this doctor anyway, in terms of his time is almost near. But this sealed it. This, like, the cough, what is it? The whatever in the coffin, okay? That you
The
got
nail in the coffin.
the
That was the
nail.
nail in
Thank
the
you.
coffin for
Thank
you.
you. Like, you gotta go. You know what I'm saying? Because now, if there's other situations kind of going on, like now I have to wonder how effective you are in terms of treating me. I don't want to, like, especially the primary care doctor, who is important for us, right? Because they're the in between, you know, instead of going to your oncologist for everything. So if we're not on the same page, or if you're giving me vibes of this ain't working. This is kind of where it goes for me as getting a second opinion. Now, here in this case, there's no need to get a second opinion. You just have bad bedside manners, you know. So it's like, do I tolerate your foolishness or do I find someone else? And because my personality is what it is, you got to go. Okay. So, you know.
I think that's definitely reasonable in that situation.
Yeah, for sure.
That's just crazy. That kind of goes to the next topic, which deals with communication and effective communication and improving errors in treatment, and I guess avoiding trial and error. So, with the example you just gave, how do you both kind of communicate with doctors and your healthcare team? We know that that's the critical part of any health wellness program, but how do each of you find that you've been able to improve your communication to reduce trial and error in your treatment plans specifically? And I think of note, and you both can tell me if you agree, when we talk about communication, it's with your doctors and healthcare team, but my experience has been sometimes it's even with the receptionist before you even get to make the appointment with the doctor, or maybe it could be with the lab tech that has to do a particular procedure with you. So how do you kind of improve communication with the whole spectrum of the healthcare team to avoid those errors?
Yeah, I think one thing that's been helpful to me, when people know that you know something, they treat you different. So again, it goes back to education. You know, when you're educated about your disease and about what's going on, you know, it's easier to come off in a different way. You know, as I said, when you know something, they just treat you different. I've seen it to where when I have went in and just was very quiet and, you know, just listening to what they said, just pretending that, okay, I'm just going to take in what they're saying. It's a totally different conversation than when you go in and you know what you're talking about. You know the right questions to ask. You know when to ask those questions, and it's about having that back and forth conversation. And it's totally different when you come in prepared and, like I said, you know what's going on there. They treat you different as a patient. It's like, oh, okay, well, she know a little something about this. I better be on my P's and Q's, or I gotta, you know, be able to respond to what she is saying there.
And I'm curious, you mentioned that because I've heard this before. Do you find like when you come in more prepared, that sometimes certain healthcare professionals kind of, I don't know if the right terminology to say, they take offense, or they kind of like,
Yep. Yeah,
I'm trying to think of, you understand what I'm saying? Like
yeah, yeah.
I've heard,
It's
they almost get
offense.
upset because you're questioning.
They get agitated. Yeah, and
Yeah.
I that's happened to me as well. I always go with a little notepad. Now I just write them in my phone and I pull them up. 3 to 5 questions every time I go. I have that. And I went in one day and, you know, I whip out my notebook and he was like, oh God, Valarie, what did you have this time? What is it now? And you know, he was serious. I knew he was serious, but he tried to joke it off. And I was like, hey, this is what I got. I got these questions for you and this is my time. So let's talk about, you know, whatever I have here on the notepad. But he did come off as he was kind of like agitated with me having prepared questions for him there.
Wow. I think the opposite. Like, you know, that's very interesting. Very interesting.
Let me just jump in there. This is why I feel it's so important. I know I be preaching this whole participatory medicine, okay? Because once I learned about it, what it's about, it's simple. It's just having that transparent conversation with the doctor. And I feel the tool of this is the conversation. And if the doctor is not open to have the conversation, that right there is telling you he or she gotta go. Okay, that they're not, they're not up to par to cope with you as the individual, as you as the patient. So bedside manner, we know some doctors just don't have it. However, they may be good doctors. Like, you have to find that balance. But if I'm coming to you with questions and you rolling your eyes, oh, you have got to be crazy. Okay, that right there, I don't even know. Like, it was enough for the example that I gave of the doctor yawning. That just threw me, because in my over a decade, in this whole myeloma thing, I've had experiences, but nothing like that. So for you to be rolling your eyes, that right there is a no-no. And to the point of other people other than the doctor, like if it's the administration, if it's the nurses, you pick up on everybody's vibe. You know what I'm saying?
Yep.
So you want them to know that you're not the one. And no one says you have to be combative, but you do have to assert a bit of, you're the patient. You're an actual individual. You're not a piece of paper. You're not the clock on the wall where it's 5 o'clock and it's time for you to go. Your being is important in that minute, So I'm gonna need all of your attention. Whatever issues you had with your partner the night before, you need to leave that over there, okay? Because that's going to be a problem, okay? But there's no wiggle room. I'm coming here like I'm on deathbed, and you talking about a dog, or you rolling your eyes, like, no.
Yeah,
That's not going to end
And was
well.
he, that particular doctor, was he looking at you? Because I know sometimes, I don't know if all doctors do this, but they have like their computer set up, and they're kind of like talking to the computer, talking to you, but not looking at you, giving that eye contact face to face. Was he doing that as well, or he's just yawning in your face?
He was doing both. Like the yawn part, like we were having a conversation where he and I are looking at each other, and then I'm telling him whatever I'm telling him. And then he got to the point, it was like quiet, pause, and then a long yawn. It's like, oh, you tired, huh? You know, it's just like, okay. So yeah.
Mm, 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 mm.
and
And I don't know, maybe if I checked him in that moment, maybe he would have apologized or something. I don't know. But just as Valerie had said, and then Melvina, as you said, like, why do I have to be doing all of this to check you? You the professional as the doctor. I shouldn't have to tell you how you need to be doctoring. You know what I'm saying? Doctor is not just to prescribe or to diagnose. It's a human contact going on. Because doggone well, if your doctor did it to you, you probably would have been like a bit taken back as to, okay, what's going on. So it's just like, as you want that respect, I'm gonna need that as well. You know what I'm saying? So
Absolutely.
I think one thing I wanted to comment on, we as Black women need to be very careful of that, because sometimes we get labeled as, oh, that angry Black woman,
yes.
or, the angry Black patient. And then we get a note in our file, and it follows us wherever we go, simply
Really?
because we are just speaking up, we're advocating for ourselves, but we have to, I guess, do it in a way to where we're not coming off as that angry Black woman. And that note or that SAR, whatever it is not put in your file, because that does happen.
Really? That's news to me, because, honey, I guess they got a hell of a file on me. Okay, because that is definitely news to me. I didn't know they do that kind of stuff.
Oh, yeah.
Yep. There's a lot. that they do, unfortunately.
Mhm.
It's a good point.
Mm.
Um, going back to trial and error before we move on, this is just an example from about a routine. What should be a routine procedure? So it took me almost a year, I think, doing research on who to perform a routine colonoscopy. And one of the first doctors was supposed to be, very well regarded. He was a good doctor, but the example of, I guess, who you have working around you, whether it's your receptionist, whether it's your nurse, kind of is a reflection on, to me, the type of service you also provide. Because it turns out, because I had did so much research, it was just, I guess, obsessing over the procedure. When I got um, the instructions, unfortunately not going as prepared as each of you both said. I didn't realize till when I got home, I'm like, hey, these instructions sound kind of wacky. So it took me, I don't know how many times to try to get someone on the phone. And each time I kept getting a different instruction. So in my head, I'm like, okay, if you can't even give me the right instructions to prep, I don't know how comfortable I feel with you. And I think what happened is that well, not the insurance, but the doctor tried to charge me anyway because I canceled the procedure. But I said I canceled because I couldn't get a straight answer, and I'm not gonna make another appointment to come and try to see you in person. It just turned out being more difficult than it had to be. But to me, it was an example of sometimes you could have a good medical source, but again, trying to reduce the amount of trial and error can sometimes start at that first initial visit and whoever they choose to, work with them. It could be something as simple as the doctor may write up something and tell you to go for a test, but somebody transposes that, and the next thing you know, you're doing another test. So, um, just to point that out. But, each of you have kind of done a great job already with leading into the next topic I wanted to discuss, which is basically becoming an engaged patient. And we know that being an engaged patient is vital and critical for successful treatment and for not just for the plan, but also for your outcome. So, what does this practice look like to each of you? And how do you think being such an engaged patient has impacted your healthcare journeys?
You want to go, Valarie, or you want me to start?
I'll let you start with this one.
Um, I feel it's like a partner, you know, um, boy or girl. Okay, it's like we're dating, and it's are we compatible? You know, if it feels like we're not compatible, or if it feels like we're going to be battling each other, then this isn't going to work. You know, so if I go to a doctor, or if I'm speaking with a nurse, or whatever the situation, I'm going to the hospital, the clinic, and I feel like the whole atmosphere is not working for me, um, the thought is to perhaps go someplace else. But we're going to be real, because we know a lot of the viewers, some people don't have it where they can just, oh, let me go on over here, especially if you live in a city, a town where you don't have doctors, a choice of in options and all of that. So it's that whole wiggle room. What is, even if it's not acceptable, like, what can you tolerate? Okay. And if you can't tolerate it, do you try to tackle it? Like, is this something where maybe you have a one-on-one with the nurse, or with the admin? Like, how's your day today? How's it going? Just, especially if you're going to see this person every week or every month. Okay. You want them to, okay. Hi, Miss Traynham, hi, Miss Manuel, like, you want them to know you. And I think I was fortunate when I was in treatment, everyone kind of knew me. Okay. So I don't know if it was because of me being vocal, I'm pretty nice when you get to know me. Okay. But they need to adapt to me.
Mhm.
And with that adapting to me, I was able to get maybe certain treatment, okay, of being nice, because if not, then you want to hear my mouth. So it's that balance situation going on. I don't know if I answered your question, but
I think you did. I think you did. Valerie, did you want to weigh in?
Yeah, so embracing being that engaged patient, I think for me it's very empowering. You know, as an engaged patient, I feel empowered because I'm advocating for myself. I have an understanding of what's going on. I think being an engaged patient is it can really help you when it comes to dealing with your care team. Just like Yolanda said, she goes in there, they know that she's going to say something, so they're prepared for there. It's like, okay, Yolanda's coming. We got to make sure that everything is good because she don't take no stuff. That's because she's engaged. If she were to come in or and not say anything or just go with the flow with whatever is going on, I think that's where a lot of I don't want to say problems will happen, but that's when patients become perturbed because they feel that they are being treated in a certain way. But for me, I think just being engaged and having an active say in your treatments, just being engaged in that whole decision making process, I think that's important, and it's empowering. But it also lets you know as a patient that, hey, this is that I do have some say. I'm not just going to go blindly along with what the doctor is saying. I have a say in this. They're listening to me. They're taking what I am saying into consideration there. So I think that is, that is a good, it's a good thing, to be an engaged patient. Engaged patient is very empowering when you are an engaged patient. And there's data that shows that engaged patients do better, overall, because they're engaged. They know what's going on. If the doctor throws them something that doesn't sound right, they know to say, okay, doc, I didn't hear it like that. Maybe come back and explain it to me a little differently because I don't understand it like you're saying it there. Whereas if you weren't engaged, it would be like, okay, well, that's what the doctor said. He's a doctor. I'm going to just go with it.
Absolutely. Was this something
and
for
can
both
I?
of you?
Oh, mhm.
No, go ahead, Yolanda. I'm sorry. Go
I'm
ahead.
sorry.
No, no.
I just wanted to add as well. You know how when you go to the doctor and the doctor is telling you, or the nurse or whoever, what's your date of birth? I know that drives me up the wall. Like, okay, I got to tell you again. Think of that as engaging, right? Because you're not just going with the flow, you're telling them who you are, okay? And and especially in that moment, you do want to be engaged because let's say you're going for an operation and you know that it's your appendix, but they're trying to chop off your leg. That's the patient over there. So you want some type of engagement, right? To know that this is who I am right here. Okay. So this is kind of where the vocal advocate comes in. So that's my little thing on there. It has to be some type of engagement, and I get it. Some of us go with the flow. I get it. Some of us are not as vocal. But again, when it comes to your health, and if things are in your head and if it's not making any sense, this is the time where you have to use your voice and ask a question, answer the question, or whatever the case is. So.
Did you both
Sorry.
find this to be something that came natural to you, or did you find it difficult to be engaged? I mean, I understand that the end result, obviously, do trial and error, kind of figured out, the more prepared I am, the more active participant I am in my treatment plan, the better. But back before it got to that point, was it difficult to even know what an engaged patient looks like? How do how was that journey for you both?
Yeah, I'd say for me, in the beginning, it was difficult because I didn't know what an engaged patient was. I didn't know how to advocate for myself, but I learned very quickly that, if you don't figure this stuff out, you're going to be left behind, particularly with myeloma, everything is it's changing so rapidly. So if you're not up on things, you'll be left behind and not really understand what's going on. So, for me, it was more learned. I am a very quiet person, and uh, it was just learning how to speak up at the right times.
And, Yolanda, did you want to add something to that?
I totally agree. Everything that Valarie is saying this evening, ditto. Um, for me as well, I would say it's trial and error, you know, depending on how long you've been on this earth. Okay, you have different experiences with different people, right? I've had experiences with male, female doctors where you may have thought it would have went a, a more pleasant way, and maybe it didn't. So, based on those past experiences, and then you telling me I have multiple myeloma, it's like it just opens the door for you not to stay in the shell of speaking up. When they're saying, "Oh, you have to do this," and it's like the script is you have to do this, this, and then what I'm supposed to just sit there and nod, like, okay, hold up, okay. Especially when we talk about needles, okay, because you already know that's not my thing. Let's bring it back. Like, what are we doing here? Okay, so certain things, if it's uncomfortable at whatever level, yeah, we need to bring this back and have this conversation. So definitely trial and
Understood,
error. You
understood.
learn along the way.
Got you, got you. So our last topic we want to touch upon is discussing pain points with your medical team and navigating that discussion about pain with your treatment with your healthcare providers. So in discussing, we know that discussing pain and discomfort could be difficult and challenging. What are some effective ways that both of you were able to explain these issues to your medical team to ensure that they were fully addressed, or or the takeaway is whether or not they have been fully addressed? If any of you have had either of you have had any experience in that realm.
Yes. So I'll say that the thing that I found most valuable when it came to talking about pain is to be specific. And what I mean by that is notating where the pain is exactly, describing the pain. It's a dull pain, it's a sharp pain. How often did I experience it? Hey, every morning when I woke up, it was just aching, and it ached till noon. So I found that being very specific with it, they understood better. It's like, okay, all right, I understand what you're saying. Um, I used to use analogies as well. I found that to be very helpful when it came to explaining pain. Okay, when I say an analogy, if I had a pain in my foot, it would, I would describe it as, it feels like a truck ran over my foot. Now, you may not have ever had a truck to run over your foot, but you can imagine the pain that you would be feeling. from that. So just utilizing something that, they could kind of get, I found to be very helpful. But just being real specific, I feel this pain every morning when I get up. It's this sharp, it's a nagging pain. It lasts for 2 or 3 hours a day, and it doesn't respond to these pain pills that you've given me. And let's talk about something else because this is not working. Versus when I was just telling them that, hey, my back is hurting. I'm not sure what's going on. It was always, oh, it's probably a pulled muscle or something. Just put a heat pad on it. And with that instance, it wasn't just a pulled muscle. It was actually an issue with the disc. So had I not went into greater detail and to explain, what I was experiencing and how often and things of that nature, I would still be putting a heat pad on it, kind of suffering through.
Yolanda, did you have anything to add?
Yeah. For me, I think just being persistent is key because, again, ditto Valarie. Pain is, what is it, subjective?
Mm-hmm.
Okay, this is what I'm feeling. And now I have to sit here and explain exactly what it is I'm feeling. Like, for me, I've had issues with my right hip for the last 6 or 7 years. Okay. But I believe part of it is the myeloma. And then I believe another part of it is, you're getting older. So I think it's a combine of both. But to explain this for the last 6, 7 years has been a trial, to say the least. And to the part, again, like I mentioned before, is trial and error. Doc, what is it showing on that PET MRI that you took a few months ago? Can we bring that up? That's how vocal I've been, because what we ain't gonna do is have me just sitting in pain and I'm doing all of these crazy tests. Like, is there something within that time frame where you can delve a little deeper and see what's happening there? Do we need to take another test or what have you? So just being persistent, especially if you have a pain that keeps going and going, like, what are we doing here, doctor? Okay. Or you're billing my insurance and you get these co-pays. So I'm gonna need you, like, what are we doing? I'm still in pain. Okay. So let's get it popping. So persistent is key.
I think one thing that also helps when you're trying to describe it is really explaining how it affects your daily, how it affects you daily in life and the things that you're doing around your home. If you're trying to work, how it is affecting you physically, but also how it's impacting you emotionally, because if you are drained emotionally because of pain, you're not going to be able to work effectively. So I think also putting it in that context where, hey, this is bothering me physically as well as emotionally, and you need to do something. We need to figure out what's going on here.
Absolutely. I know we have to wrap up soon, but there's a book I read recently I want to reference to that the doctor that wrote it, physician, is from my alma mater, and I hope I get her name right, is Dr. Uche Blackstock, and the name of the book is called Legacy: A Black Physician Reckons with Racism in Medicine. And I bring it up because there's a whole chapter dedicated to pain from the perspective of a physician now, a Black physician. And she talked about one of the hospitals that she worked in where I believe it was an emergency room, but she kept observing this person kept coming in frequently enough for her to recognize him, but she never had the opportunity to treat him. And every time he came in, he was complaining about being in excruciating pain. And she listened to her colleagues, sort of characterize that pain as, oh, what's a drug addict looking for something, whatever the case was. Long story short, I think she ended up treating him one time in an emergency room, and come to find out he had sickle cell anemia and was going through, what was a painful flare up, I guess it's called, and had someone address that. Obviously, like you said, Yolanda, early in the conversation, not everybody has a primary care physician, unfortunately. Sometimes your local hospital becomes your primary care physician. The danger in that, with this young man's story, is that each time he came, that was never addressed. So had they learned to manage that pain the first couple of times, he wouldn't have been blacklisted as,
Yes.
quote unquote, addict or whatever the case was. So I guess I bring it up to mention, and also reading this book and just hearing about the perspective from doctors within our system. And I remember the first time I heard this, I thought I was going crazy, but the darker your skin, the higher the tolerance of pain is. So a lot of the times, whether you have a chronic condition and when you're asking for, to manage that pain, the belief is, unfortunately, as it's kind of, I guess, kind of unsaid, taught, is that, oh, they could tolerate it. And I've actually witnessed that at least twice after having procedures where, one, I was in pain. I guess you could say, no, I have I guess, a higher tolerance, but I literally heard someone practically screaming in recovery, and I overheard the doctor, because I wasn't, that far out of it, saying that we've already given her this. I don't want to give her more. She could tolerate the pain. I'm like, what? I think the other time was when I was in a maternity ward, and I witnessed the nurses listening to someone screaming. I think this lady was Latino, screaming at the top of her lungs. And it's like, oh, they do this all the time. But it kind of characterized they do this all the time, not this particular patient, not, in other words, instead of thinking of us as individuals, it's like this blanketed stereotype. So I'm just wondering, does this factor into, obviously not every physician, but the fact that a physician wrote this book and said that, at least with her peers, how many other doctors, it's kind of like the same thing. So that's a scary thought, I think.
Who was the author of that? Who was the author?
Her name is Dr. Uche, and the last name is Blackstock. And I think it made the New York Times bestseller, but it's called Legacy: A Black Physician Reckons with Racism in Medicine. And I believe she's the founder of Advancing Equality in Healthcare. That I could look back up and get back to you. But she's been a big advocate of equity, healthcare equity, again, among people of color, and just really being a vocal voice for the community of what's going on.
Yeah. Wow.
It's a really good book. It was very eye-opening. It's like, oh my goodness, this is very eye-opening. Like I said, from that perspective, not from the patient perspective, actually from a doctor. So it was really, really eye-opening. But I know we're coming towards the end. But do either of you have any final thoughts you want to share about today's conversation? Obviously, there's so much more. Yolanda, you might have to have a part 2 to this.
I think we do. There's so much to delve into, to be honest with you. Yes.
Yeah.
I'll
Absolutely.
say, like, in all of the topics that we've covered this evening, I think two very important things that patients need to know, that when you're dealing with the invisible illness, really you have to learn about your illness so you can educate others, to let them know what you're experiencing, because they'll never know, because you just looking from the outside, you look fine. And they're going to make that assumption that you are fine. So I think it's our responsibility. Unfortunately, we do have that, but it's our responsibility to educate them so they know what it's like to have an invisible illness and what we do go through. And in addition to educating yourself about it, learning how to advocate for yourself. I think in each of the questions that we talked about, those are two things that really stood out to me in all of them. Being educated, knowing what's going on, and knowing how to advocate and speak up for yourself. And a lot of people get scared when they hear that word advocate or self-advocate. It's nothing to be afraid of. It's just simply you saying what you want. It's just that simple. You are speaking up and saying what you want. making your thoughts known. And that's, I think if a lot of people understood and that they looked at it like that, that it would be different when it comes to self-advocating.
Absolutely, absolutely. Good points. Good points. And I see Yolanda is posting contact information for each of us to further continue the conversation. Yolanda, did you have any closing things? We have like 1 minute, 2 minutes left.
I just want to say, just being persistent. Everything that Valarie has said, I totally agree. It's a journey. Sometimes having these conversations, excuse me, is not pleasant. Sometimes you have to divulge more details that you may want to with this stranger, in the beginning, but it's necessary. So being persistent and being engaged, those were like the key points that we mentioned this evening. And by doing so, you'll kind of swat out those that should not be part of this experience that you're dealing with. Okay, you'll know right away if this doctor is it, or if this hospital or clinic is the one.
Absolutely, absolutely. Well, thank you again, both of you ladies, and thank you, Yolanda, for this special presentation. And leave you with the thought, there's no better time than the present. And please check out Yolanda. She does this often. She's a force to be reckoned with in the healthcare space of advocacy. And Valarie, you as well. And I thank you both for sharing your lived experiences. I think it's going to help whoever's out there listening. It's going to empower them. It's going to encourage them. And the more we have, patient leaders like you, the better off the healthcare community is. So I just want to thank you both for being so candid and honest tonight. Thank you.
Awesome. Thank you. Thanks for having me.
Thank you.
Thank you.